in Henderson, Nevada. I'm a board-certified family physician, and we're continuing our video series on wheat belly and grain brain. In Chapter 5 of Wheat Belly, the author makes the core argument to the book, and the core argument is this. Wheat has a high glycemic index, and when you eat high glycemic index foods, that raises your level of insulin. That high insulin level then causes your blood sugar to drop down, which makes you hungry again, which makes you eat more wheat, which makes you eat too many calories, and makes you develop fat in your belly, and gives you all sorts of chronic disease like heart disease and diabetes and that sort of thing. The argument is made entirely without reference to scientific studies that support it. It's simply asserted. And it has to do this because the book really has a giant mountain of evidence that it has to climb to try to establish that wheat actually causes belly fat. Because when you examine the literature and the scientific studies, they actually show the exact opposite. People who eat whole grain foods have less insulin, less resistance to insulin, lower body fat levels in the belly, and lower rates of obesity and diabetes in study after study after study. If you look at the blog post, you're going to see links and lists to all of those, but I just want to make that very clear. What the book tries to say is that all wheat is bad for you, and white flour is really, really bad for you, and whole grain flour is slightly less bad for you. So if you substitute whole grain flour for white flour, that's like substituting low tar cigarettes for high tar cigarettes. That's exactly backwards. What really happens is, when you eat a lot of processed food and white flour, you generally are going to have significantly worse health. A lot of bad foods go along with white flour and processed flour. And so you're going to eat burgers, you're going to eat hot dog buns, you're going to eat white bread, and those foods tend to be really problematic. When you eat whole grains, you actually reverse the process. You get less belly fat, you have lower insulin sensitivity, higher insulin sensitivity, lower levels of insulin, and you also significantly reduce your likelihood of getting diabetes. So, when you're substituting in whole grain foods for white flour foods, it's like substituting fresh mountain air for cigarette smoke. And replacing whole grain foods with high fat and high protein foods like the book recommends is like switching from fresh mountain air to cigarettes in terms of your risk. It's like saying you can reduce your lung cancer rate by smoking more. So the book is really backwards on this area, and I really ask that you investigate this yourself. I investigated a lot and found nothing to support the book. In addition, the book talks about a study of celiac patients, and the book tries to make the claim that a majority of celiac patients are overweight. But when you actually check the study, it's actually only 39% of the patients who were either overweight or obese. And the majority of the patients were normal weight or underweight. The book just gets this wrong. The book, in the end of this chapter, really lays its cards out on the table. The book doesn't care so much about wheat or so much about gluten. It's just promoting a standard low carbohydrate diet. And at that point, the book even tells you not to eat spelt or potatoes or corn or rice or any of the many foods that have generated such health in so many civilizations in history that we can study. So unfortunately for the book, if people are paying really close attention to the message of the book, which is to get rid of all your carbohydrates, not just wheat, those are the people who are going to suffer the most. Because a low carbohydrate diet is a very dangerous way to eat. In study after study, it shows increased mortality, higher rates of diabetes, and higher rates of cancers in people who eat a low carbohydrate diet. So don't follow that. Follow a healthy diet, a starch-based diet that's very low in fat, and we see remarkable results. Thank you for your time. If you have any further questions, please visit us at drallenwellness.com. Thank you.